Hey everybody, it's Dr. Mark Burdorf, board certified chiropractic neurologist in Scottsdale, Arizona. And today I want to show you RightEye. It's a diagnostic test that I do here in the office, and I want to explain why we do it and what we can do to make your vision better. So let's begin. So after we've entered the patient in, you can see here we have to be between 56 and 60 centimeters. And you notice that when I tilt my head, how the software picks up my head movement. Okay, so, all right, I'm going to start the calibration. And there's no head movement, it's all eyes. Okay, now you can have 2 X's or less, but I had a perfect score there, so we're good to go. So now what we're going to do is some pursuits. So again, no head movement. Now we're going to do it horizontal. We're now going to do it vertical. Okay, that was pursuits. Now saccades are the quick ones. So in a moment here, I'm going to see 2 white circles on the screen. And when I physically look at the circle with my eyes, I'm going to turn it white to green. It's like imagine playing a video game with your eyes instead of a hands on a controller. Now the first 3 is a warm-up, and after that, the faster and accurately I look back and forth, the better my score will be. Okay, now the same thing from top to bottom. Okay, now we're going to fixate on some objects. Everything's for 7 seconds. I'm not going to pick a single spot in the very center of those 4 dots and fixate on it. Now I'm going to fixate on a single dot. Okay, now I'm going to do some eye-hand coordination. So I'm looking at a solar system. When targets pop up, I use my eyes to look at them. So in this case, alien is 1. Back to center. If I see an astronaut, it's 2. Back to center. 3 is the Earth. Okay, now I'm going to practice. They come from all directions. Okay, now it's going to be a little easier. If I see the alien, I'm going to click 1. If I see the other 2, I do not. Again, this is just instruction. Alien, I press. I just look at it once, do not press back to center. The same thing with the Earth. And I'm in practice, they come from all directions. Okay, so now that I've completed this test, we're going to look at my assessment. Okay, so the perfect score is 100, and Henry Cejudo, back in May of 2020, he scored a 99 out of 100, and Elijah Garcia, I've been working with now for about 2 years, he scored 98 many times. The best I've ever personally done myself is a 97, so today I had a 95. And the important thing you remember is green is great, orange is a warning, red is bad. So the name of the software is RightEye, but you can see it's actually both eyes. And we can play it back in real time. And just to really simplify what I'm trying to do here is you want to see all these lines very tight. So if you're seeing lots of lines going outside, that's a bad sign. And so pursuits are parietal lobe, it's sensory motor, pain and suffering, which is up here. Saccades are more frontal lobe, which is behavioral. And then your frontal lobe with your cerebellum allows you to fixate. And I see many patients that don't necessarily have pain per se, but they a lot of times have movement disorders, weakness, and balance issues. And this here is very important. This is eye-hand coordination, and again, I had great scores today. The reason my score is a 95 is I do these every day, okay? And if you want to have a strong neck and make your brain work better, then you have to do this exercise. And that's what we do here. We call it neurovision therapy. It's basically a form of physical therapy, but it's all neuro rehab. And you want everything to be in the greens. And the one thing I still need to work on a little bit is my saccades. And that's something a lot of times seen with aging. But again, this is the test called RightEye. It takes about 5 minutes. So if you have problems with balance, dizziness, headaches, chronically, and it's not getting better, then obviously you're a candidate to come see me. If you want to be a better athlete, which means being better at, if you're over 50, if you play pickleball, if you're in your young age like Cejudo and Garcia, if you're a professional athlete, combat athletes, you definitely need to see me to make sure that you're the best that you can be at your sport. So I hope you learned something today. Have a great day.